This video is for demonstration purposes only. When applying the Miami J Select collar, it's important to follow spinal protocols. Please reference the instructions for use for warnings, cautions, and general safety instructions. Miami J Select is an adjustable collar suitable for most adult and adolescent patients. Some patient phenotypes and anatomical variations may not be accommodated. The interior height adjustment mechanism on the Miami J Select can be adjusted to fit 85% of the population. If you are familiar with the phenotype-based sizing system utilized in the original Miami J, it will fit 4 of the 6 individual phenotype-based sizes. The Miami J Select is suitable for stout, tall, regular, and short patient phenotypes. The Miami J Select has not been tested in super short and X small patient phenotypes and should therefore not be used on these patients. The recommendation is to use the Miami J for these patients. Also, if the patient's neck circumference is over 25 inches, consider the Miami J bariatric collar. Once the patient can sit or stand following initial application, check spine is in desired treatment position and adjust height setting if necessary. To ensure proper sizing, it is a good idea to fit operative patients prior to surgery. Collar size may be incorrectly identified in the presence of post-operative dressings and swelling. Ensure the correct facility spinal protocols and C-spine precautions are followed throughout the application. Ensure the padding extends beyond the edge of the plastic and the sternum relief knob is oriented vertically. Slide the back panel behind the patient's neck and center it, noting arrow on panel pointing up. Note, long hair should be placed outside of the plastic. Holding the collar against the chest with the bottom of the tracheal opening at the level of the sternal notch, depress the height adjustment button. Manually adjust the chin support to achieve the desired height. Adjust to the height that fits most comfortably and maintains desired treatment position. When desired position is attained, engage the patient compliance lockout located behind the height adjustment button by moving the lever to the left. Use the height indicator marks to record patient's collar height. Height settings 2 through 5 will be used most frequently. Height settings 1, 6, and 7 will be required less frequently. Slide the front of the collar up the chest wall until the bottom of the tracheal opening is at the level of the sternal notch. Sides of the collar front should be oriented up, off the trapezius and towards the ears. Verify that desired height is achieved on both sides of the brace. If needed, depress height adjustment button and make micro adjustments. While holding the front securely, place the sides of the collar front within the sides of the back panel. Apply the straps of the back panel to the hook landing areas on the front. Tighten straps alternately to an equal length on both sides. Straps must be aligned with the hook landing areas. When the patient is properly fit, there should be equal amounts of excess straps overhanging the hook landing area. These may be trimmed. A properly applied Miami J Select will look like: collar extends from mandible to just below sternal notch. Chin is centered comfortably in chin support. Chin should not extend over edge of Sorbatex pad nor fall inside collar. Straps are aligned to the hook landing area and are an equal length. Sides of back should overlap sides of front. Front of collar angled up toward ears, lower plastic edge should not be resting on patient's clavicles nor digging into trapezius. No plastic touching skin. Sorbatex pads extend beyond all plastic edges. No slack or gaps in any of the straps. Tracheal opening and posterior vent are midline. Collar sits away from the neck. There should be a finger gap between the tracheal opening and the neck. If the collar fits too closely or tightly to the neck, size up to the next taller size. The blue sternum relief knob adds a degree of freedom for the patient, so eating or talking can be performed with greater comfort. The knob turns 90 degrees to a horizontal position. Please reference the instructions for use for warnings, cautions, and general safety instructions. For patients with high risk of occipital breakdown, the Ocean Back is an available option to replace the back collar for supine patients only. It is designed exclusively for the specialized needs of the multi-system trauma patient in the ICU. Once the patient is ambulatory, the Miami J Select back collar needs to be applied. The Ocean Back is a universally sized device to fit all adult Miami J front collars, as well as the Miami J Select front collar and the Miami Junior P3 front collar. The Ocean Back Junior is designed to fit the Miami Junior P2 front collar. Ensure that correct spinal protocol is followed throughout the supine application. Remove any pillows from behind the patient's head. Position patient with arms to the side, shoulders down, and head centrally aligned. Remove the original collar back piece and slide the Ocean Back piece behind the patient's neck to center it. Note the Ocean Back arrows pointing upwards. Ensure the padding extends beyond all plastic edges of the collar and ensure long hair is placed outside of the Ocean Back. Retain the original collar back for use when the patient becomes ambulatory. Flare the sides of the collar front out, slide it up the chest wall, and scoop it up under the chin. The sides of the collar front should be oriented up, off the trapezius, and toward the ears. Place the plastic of the collar front in between the back piece, padding, and plastic. This will ensure that the padding of the back piece is against the skin. While holding the front collar securely, curl the ends snugly against the patient's neck. Apply the hook and loop strap and secure the opposite side of the collar in the same fashion. Tighten straps alternately, one at a time, to an equal length on both sides. Hook and loop straps must be aligned to the front collar adhesive sections. Excess may be trimmed. Collar and Ocean Back application must be secure to ensure proper fit, maintain alignment, and prevent the chin from slipping inside. If the patient can slip his or her chin inside the collar, it is a clear indication that it is not snug enough. It is important that the patient's skin condition is checked regularly every shift using correct hospital C-spine protocols. Before removing the collar, note where the ends of the hook and loop straps are. When the collar is replaced, the straps should be in the same position. Position patient flat in bed without a pillow. Keep their head in a neutral position. Do not allow the neck to bend forward, backward, or from side to side. Position patient with arms to the side, shoulders down, and head aligned centrally. While maintaining C-spine precautions, gently slide the posterior piece from behind the patient's neck and then remove the collar front. Inspect the patient's jawline, clavicles, and sternal area for any potential pressure problems. Once the patient has been properly log rolled in accordance with correct spinal protocol, check areas such as the occiput and C7 for any signs of pressure problems. It is important that the patient's pads are cleaned regularly. Replacement pads are available for the Miami J Select. Remove the pads from the plastic shells. Hand wash the pads with mild soap and water. Do not use harsh detergents or bleach. Rinse. Wring out the excess water and squeeze in a towel. Lay flat to air dry. Wipe the plastic collar shells clean with mild soap and water. Replace with clean, dry pads by attaching the gray side to the hook on the inside of the collar. The Ocean Collar Back or Ocean Junior may also be easily cleaned. Follow C-spine precautions when applying or removing the Ocean Back. Peel the soiled Ocean pad off and perform the following on both the pad and the outer shell. Wipe with a damp cloth and mild soap. air dry. Do not machine wash, tumble dry, iron, bleach, or wash with fabric softener. Avoid contact with salt water or chlorinated water. In case of contact, rinse with fresh water and air dry. Dry the collar and the surface of the pad thoroughly with a towel and reattach the pad. Fold the pads in half with the logo printed side next to the hook and loop. Center the pad in the white shell.